So, dear Dr. Sabalza, we are very excited to have you here today for the interview. Could you please tell us a few words about yourself, your role in the country delegation, and your background and focus in your practice?
Okay, so again, I'm Dr. Michael Sabalza. I'm a neurosurgeon from the Philippines. I've been practicing neurosurgery for 24 years. I'm currently the section head of neurosurgery in Makati Medical Center and also the section head of neurosurgery in Quirino Memorial Medical Center, which is a public hospital. It's a 1,000-bed public hospital. My focus of practice?
Yes.
Well, in the Philippines, since there's very few of us, we usually do everything, but so there's no real focus of practice. What comes, we do.
All right.
Yeah.
Could you tell us a little bit about what motivated you to get involved in neurotrauma research?
You know, trauma, every day you see trauma in the ER. And you know, with the many patients that you see, you always ask yourself, is there a better way of doing this or making the survival and the recovery better? So, because there's a tendency for you to, it's head injury, he's a gunner, there's that sense of, that attitude that, can't do anything else. But I don't believe that. I think there's a better way of doing things. And that's why I'm here.
I agree with you on that. Are you satisfied with the management of neurotrauma in your country?
Oh no, I'm far from being satisfied. First and foremost, there are very few of us. We are a country of 110 million, and we have 7,100 islands, and there are only 140 of us neurosurgeons, half of which is in Metro Manila. So the rest of the country, in some areas the ratio is around 1 neurosurgeon to 1 million population. So, and sometimes there are certain islands that do not have the service of a neurosurgeon. So, so just imagine if you experience head trauma in an area where there is no neurosurgeon, or the neurosurgeon is 6 hours away, 8 hours away. Definitely you will think there must be a better way to treat these patients.
Yes. That is unfortunate, but do you have any suggestion for improvement of the conditions besides bringing more capacity?
Actually, now with the advent of the cell phone, we actually manage a lot of these patients remotely. So a patient that is seen somewhere where there is no neurosurgeon, usually we have a sort of a network wherein general physicians or emergency room doctors can contact us, send images, and sometimes gives us a heads up on what the situation of the patient is, and usually we eventually ask them to transfer. But at least the initial management, the initial assessment can be done over the phone. Yeah.
That is truly a
I've actually allowed a surgery resident to do a brain surgery while on FB Messenger.
Okay.
And the patient survived. So, we adapt to the situation.
Truly, this is a very innovative approach.
Yes.
On the same topic, do you feel that an online community for those interested in the management of neurotrauma would be helpful in medical practice or in research?
Oh, definitely, because one of the things that's actually very lacking right now, not actually lacking, but absent right now in the Philippines, is we don't actually have a brain trauma, a head trauma registry. So if you ask me about statistics on head trauma in the Philippines. I cannot give you any accurate numbers on that. We've been trying to establish a head trauma registry, but we haven't been successful. Maybe if we have a pattern to follow, maybe we can start one.
All right. You actually answered my next question, which is, what is your opinion about an international TBI registry, and how do you believe it would impact TBI management on the long term?
Further management and actually programs for managing TBI will actually depend on your data. So depending on the data, then you can make correct judgment, correct decisions, correct plans in the future to improve on TBI management. That's a problem right now. We're kind of blind in the Philippines. We know that there's a lot happening, but how many, what's the percentage of mild, moderate, and severe? How can we improve on the, how can we improve on the management and eventually the survival of these patients? Unfortunately, TBI, like I always say, TBI is not sexy enough. So a lot of people, there are not a lot of neurosurgeons who are interested in TBI because
other domains present more interest for them.
Brain tumor surgery is more sexy, aneurysm surgery is more sexy, but TBI, but if you look at the caseload, the burden, you don't get a stroke, an aneurysm every day, but every day you get head trauma in the emergency room. Every day of the year you will have. So I think it's high time that we address this disease, or not, the condition.
Truly.
Yeah.
Could you highlight the main challenges in the treatment and research of neurotrauma in your country and specifically your institution?
Let's go by the country first. Right now, like I said, our main problem is we lack neurosurgeons.
Yes.
By WFNS calculations, we lack 400 more to serve the country. So one, we need more neurosurgeons. Secondly, it's also the facilities. Like not all hospitals have a functioning CT scan. They may have a CT scan, but you're not sure if it's functioning. And the logistics of it, the fact that we're spread out, we're an archipelago. So it's not unusual for you to see a patient 3 days after the trauma, if he survives to get to you. But that's one of our main challenges, is how to get these patients to a hospital with neurosurgical services.
And these are specific for your institution too, or do you believe there is something?
For my institution, my institution, at least the 2 public hospitals that I work in, because most of the trauma patients go to the public hospitals. Both of my centers have neurosurgery training programs, so at least there is a neurosurgeon on hand at any time. The only problem is, again, the availability of the CT scan. One of my hospitals, they have 3 scans, but sometimes all 3 are down. So you can imagine moving a critically ill patient, loading him up to an ambulance and bringing him to another hospital just for another scan. Yes. And then go back to the hospital. So that's a big treatment gap as far as I'm concerned. Secondly, there's also a problem with our availability of operating rooms. Sometimes, even if a patient is already diagnosed and is already needs surgery as soon as possible, but if there's a long line in the OR, sometimes they may have to wait a day or two before they get surgery.
All right. That
Yeah.
is
That is sad.
that is
That is sad.
otherwise.
Yeah. So there's a lot of room for improvement, really.
Yes. Could you describe some innovative approaches that you believe could bring a substantial change in the treatment of neurotrauma that you've seen in other places, examples of good practices?
I think in other places, I can't really say that I've seen things in other places, but the things that have worked for me so far is, at least neurotrauma. It's important that the first responders or the first doctor who sees them in the ER know how to manage them. I've seen, so I think it's important to, as far as the tertiary hospitals are concerned, I think it's already okay. It's in the primary and secondary hospitals where these patients are initially brought for resuscitation, diagnosis. They're sometimes managed poorly, or at least the injuries aren't recognized. So I think that's the area of improvement that has to be done, meaning we have to train the doctors in the lower level hospitals to recognize head trauma, how to manage them at least initially, and also to for them to refer in a timely manner. Not like when the patient is already deteriorated, that's the only time they'll move them to a bigger hospital.
Yes. So the time seems to be a big problem.
Yes.
Neurotrauma.
Yes.
What are, in your opinion, the most important quality indicators for neurotrauma care?
Well, of course, the survival and quality of life for me. That's the most. That's the most important. Every life. I mean, we should value the life of every patient, and if we can improve the quality of life after TBI, I think that's very important. So for me, that would be the best gauge.
That is a very good answer. A multidisciplinary team is a vital asset in the TBI management.
Yes.
As we know, from your point of view, what are the specialists that should take part in the management of neurotrauma, and why do you think those specific ones are?
Right in my two private hospitals, usually TBI is managed by just the neurosurgeon and the neurocritical care, the neurointensivist. I think a good neurointensivist and a good neurosurgeon working together will, at least, that's the basic for a multidisciplinary team. Of course, later on, if the service expands, then there should be the rehab services, the very important the psychological and psychiatric follow-up and care of these patients. I think that's something that is overlooked. Sometimes when we send this patient home, we forget about them and how they're doing at home. Are they back to work? Are they productive? Those things are, for me, very important, but seem to be overlooked because we're just so focused with just what their condition is in the hospital, and when we send them home, we don't see them anymore.
Truly.
Yeah.
So we should have a long-term outlook on the...
Oh yes, and I think it starts with having a relationship. Me, I build a good relationship with my patients, and I'm quite easy to reach. So even these patients who I've seen years ago, they usually come back to me for for anything. But at least, you remind them that, you should, even if you're okay, you come back, because even if you're okay, if we test you, we might see something like if you do a psychological test, we see that you still have a problem, and it's something that we can do, something we can do about. Yeah.
Right. So on the same note, what do you think that the main challenges in preventing neurotrauma would be?
In the Philippines?
Yes.
Preventing.
In the Philippines, and worldwide.
First and foremost, we don't have a prevention. Prevention has to come from the school. That's what I believe. I think we should go down to school level and teach, or at least inform the students about prevention of head trauma in sports, and later on when they start driving. I think it's too late if you teach the motorcycle driver to remind him that you should always wear your helmet.
Yeah.
Yeah. But right now, almost half of the registered motor vehicles in the Philippines are motorcycles, and in Metro Manila, in the capital, the enforcement of wearing helmets is very strict. But if you go to the province, it's nobody wears a helmet. And I'm 100% sure if that patient goes into a major accident, there definitely he will have TBI. I have no doubt.
We told the management afterwards.
Yes, yes.
From your point of view, what are the main obstacles in terms of collaboration in a multidisciplinary team?
Collaboration in a multidisciplinary team?
Yes.
It's actually the availability of the other team members. There are, I think I can count with my fingers the neurointensivists in the Philippines. That they're that few. So training more neurointensivists is one. Having a clinical psychologist to do psychological tests on the patients, that is also some challenge, because since most of the patients are in the government hospital. I realized recently in one of the meetings in the government hospital, the pay for a psychologist is so low in the government hospital. It is so hard to attract a clinical psychologist in the government hospital. So we're actually now offering them part-time work. So you'll be allowed to just work part-time but get a full-time salary just for you to be attracted to go to a, because it's less than half of what they would make outside.
All right.
Yeah, so that's one of the challenges in having a multidisciplinary team in a government hospital. In a private hospital, of course, it's a different issue. Most of the components of a team is usually available in a private hospital.
Okay. Could you identify the strongest and the weakest points in the research of neurotrauma today?
Strongest point. I think now with computers and everything, it is so easy to accumulate data. The only problem is, I think there's no uniformity yet. I think like us in the Philippines, we don't even have a head trauma registry. And, having a uniform way of gathering evidence and being able to study these cases, I think that's one step that's needed to have, for us to be able to sing one song. Yeah.
Yes.
Because almost every country has its own. But to be honest, like the World Federation of Neurological Surgeons hasn't actually mandated that here you use this program to record your brain trauma patients.
So uniformity would be a big step forward.
Oh yes, oh yes.
Research. Right. How do you think that COVID-19 impacted the neurotrauma management or the caseload?
Okay, so these are actual cases. Our main problem during the COVID, well, first and foremost, because everybody was on lockdown, so definitely the numbers were down. But there are still a few who would have suffer from head injuries. The main problem was, having the COVID test before the surgery, and if the patient isn't tested, doing it in a level 4 protective on level 4 PPE, that is so hard. When you wear level 4, do brain surgery for around 4 hours, you're sweating inside all over. So that is one of the challenges that we had. But the delay, there is definitely a delay in management because the patient either has to be tested or we usually just reserve a few operating rooms for untested cases. So the patient has to line up in that room, plus the disinfection in between cases. So yeah, it slows down the management basically.
Yes. And the last question I have for you is, are you familiar with the AMN organization, or have you participated in any of our congresses, either as a guest or as a speaker?
No, this is the first time.
All right.
This is the first time.
It's no bad answer. It's just...
Yeah, this is the first time, and hopefully this will be a productive one.
We hope so too.
Yeah.
So thank you very much for your interview and for your time, and we are enthusiastic to have the next day together and discuss multidisciplinary approaches to neurotrauma.
Okay, thank you.
Thank you very much.
Thank you.